Hi, I'm Scott McKenna. I'm the Chief Information Officer for Nova Scotia Health Authority and IWK Health in Nova Scotia. I've been there 3 years and really trying to transform, digitize and a transformation health in Nova Scotia. Not just healthcare, not just our hospitals, but the whole system from primary care, hospitals, across the systems are centered around the Nova Scotian. To me, the biggest part of digital transformation is really not about technology at all. We live in a technology age. It's about data and about people. It's always about people. We centered, instead of looking at things around the technologies and centered on our health systems, really look at it, what are we doing for the Nova Scotian? Let's center it around the Nova Scotian. And I know we talk about patient-centered healthcare a lot. I want to move to, we're talking about citizen-centric, consumer-centric. And so what we do is we look at how do we help the Nova Scotian navigate, how do they help empower them with information so they can work through a really complex and get the needs, the care, the information that they deserve in their communities. Bringing all the key stakeholders in healthcare is really difficult together, but if you really focus on the patient, the citizen, the consumer, at the end of the day, everyone wants to provide great care. They want a healthy population, and it starts with our political figures, our premier, our minister, our leadership and our CEOs and deputy, helping provide people information. In Canada, nobody has a full health record around you or I. It's piecemealed in pockets of who your care provider is. And that's a problem. That's a problem both from safety, it's a problem from wasting time from providers when they're looking for information. So we centered around that. How do we bring those desperate pieces of data, your health record together, so everyone has the information that you deserve? Interoperability is something we've all been hearing about and we've been talking about it for 20 plus years. In Nova Scotia, we've achieved that. We really have made the impossible possible. And it's been an incredible journey. In about 2 years, we rolled up the sleeve, we had the vision, we're going to do this. We had the commitments from everyone aligned. And we broke down those silos. And it started by standardizing how we need our health data, make sure we're using standards that are international, and then building pipelines, building technology, data pipelines to all the parts of the system, whether it be your family doctor, virtual care, our hospital system, to bring that data together to create that. So we've achieved interoperability without worrying about technology. Data can flow across any systems. The finance industry has done it for years. We sure as heck can do that in health. And we're now taking Nova Scotia to the leading edge of North America. I have incredible support, incredible people around me. I'm just lucky to be here. We do everything because of others. It's hard, it's been a hard slog, but when you bring the right people together, you empower people and you have one laser focus, we swim downstream together. We talk about strategy and vision, and then we roll up the sleeves and execute. Everybody understands what we're trying to get to, what we've been doing, and we're running. And we're running and we continue to run. I know that the rest of Canada's watching, and I know that others can learn from us the way we've learned from other people, and we can spread this across this country and improve health across coast to coast to coast.
Congratulations to Scott, who is the Canadian CIO of the Year Public Sector. Scott led one of Canada's most complex health digital transformations. He has shown what's possible when technology truly serves people. Winning this award puts Scott in the CanadianCIO Hall of Fame. It honors Scott as a transformational leader in public service, showing that he can be both compassionate and courageous.
Yeah, it's one of those awards really humbling. It's very humbling to have this. What means a lot to me is that someone took the time to nominate me. It's very meaningful. Anytime I get to travel and represent the organization, it's really not about me. I have the privilege of doing that. It's about everyone else. Like, we stand here because of all the great people around us, and everybody's going 150 miles an hour together. And that's why we have these opportunities where we're moving Nova Scotia to the front and center in healthcare in Canada, and it's all because of everyone around us.